dignitaries on the dais, Dr. Pratap C. Reddy, Chairman, Apollo Hospitals Group, Sir David Dalton, CEO, Salford Royal NHS Foundation UK, Ms. Shobhana Kamineni, President CII, and the Executive Vice Chairperson of the Apollo Hospitals Group, Dr. Sangeeta Reddy, Joint Managing Director, Apollo Hospitals Group, Dr. Anupam Sibal, Group Medical Director, Apollo Group, Professor Ganpati, all our distinguished international guests, delegates, various speakers in this two-day conference, invitees, media, ladies and gentlemen. It indeed gives me immense pleasure to join you all today for this twin conference, the 7th International Conference on Patient Safety and the 8th International Conference on Revolutionizing Healthcare with IT. And I must begin by commending Dr. Pratap C. Reddy for organizing this twin event on two very relevant subjects related to healthcare in India and the globe. I also want to congratulate the awardees today, whom I happily gave away all the awards, and I was very glad that the different hospitals within India and outside India were all mostly represented by our women, so that goes on to give a message that the very important agenda of today's conference, which has become a concern globally, especially for the developing and the underdeveloped countries, which is patient safety, if left to the hands of women, will no longer be a concern. That's the message it gives. My dear friends, patient safety and the use of technology in healthcare would be instrumental in fulfilling the vision of the National Health Policy, which has been rolled out recently after a gap of nearly 1.5 decades in India, which talks of ensuring universal access to affordable and quality care to everyone in India without anyone having to bear financial hardships as a consequence, because India is primarily concerned with the out-of-pocket expenses which people have to bear, and which is even making them go below the poverty line. So that's one of the objectives and the vision, of course, laid down under the National Health Policy, which has come up lately in the country. Patient safety, as I said earlier, is a challenge now which is being acutely felt in both the developing as well as the near-developed countries of the world, and thus it is an issue which needs our undivided attention. This discipline encompasses prevention of harm to patient caused by the process of healthcare, and thus improving patient care would actually mean reducing the harm to patients during hospitalization, during the entire procedures of healthcare. And the first idea of patient safety is enshrined in the Hippocratic Oath itself, which emphasized upon the concept of do no harm. And although the concept of do no harm sounds quite old, but I would say that it still is quite relevant even with the advent of modern medicine as well as the complicated procedures. The WHO estimates tell us that 1 in 10 patients are harmed while receiving hospital care. So which is a number we seriously need to think about and bring down. The assessment of injection practices in India by the India CLEN Program Evaluation Network in the year 2002-04 indicated that 3 to 6 billion injections are administered in India every year, and nearly 2/3 of these injections are unsafe, which is a serious cause of concern for us. And in CLEN 2014 study on biomedical waste management situational analysis and predictors of performance in 25 districts across 20 different Indian states also showed that 82% of our primary, 60% of our secondary, and 54% of our tertiary healthcare facilities were in the red category of the study classification, implying no credible biomedical waste management system present, but that needed major improvements. Even fake drugs now a concern for us, and equipments being unusable many a times or only partly usable due to lack of skill of the healthcare professionals is also a cause of worry. There are several factors factors which could be affecting patient safety, and there are several high-profile cases of surgical errors involving large compensations. And as healthcare policy makers, we should ensure that such situations do not arise and that the interest of the common man or woman is safeguarded when he or she accesses the health systems for care. Regulatory mechanisms should also be in place to address the cases that land up with the healthcare-associated harm. And the fear of punitive action will also improve caution among the healthcare providers. So what action is required to ensure patient safety is the most automatic and natural question which comes to our minds. My dear friends, patient safety can be addressed through a multi-pronged approach directed towards laying the SOPs for patient handling, diagnosis, treatment, etc., and the adoption of hand hygiene and other universal precautions, availability of checklists, the rational use of medicines, training of healthcare professionals, the strengthening of the healthcare infrastructure and a hospital accreditation program, and the general awareness among the patients. Universal precautions also help in reducing the risk of hospital-acquired infections, and simple things like the hand hygiene, gloves, facial protection, clean linen or needle disposal, service patient care equipments, and proper disposal of wastes along with patient etiquettes are low-cost interventions which can help in reducing the additional healthcare cost. In addition, patient safety research is also equally important to identify areas of potential harm and develop alternatives. In India, we have actually done a lot of things, but they're all in a kind of fragmented way. For example, we constituted the patient safety committees in almost all the tertiary healthcare facilities of the Government of India, but training modules were also developed and checklists were even adopted. We also developed the National Quality Assurance Standards for our public health systems. Kaya Kalp is a novel initiative by the Government of India, which basically emphasizes on the infection control practices and maintenance of high levels of sanitation and cleanliness within the hospital premises, and we even give awards which are called the Kaya Kalp Awards to facilities which maintain such sanitation, high levels of sanitation within their premises. Quality assurance exists under various programs, which are the Mother and Child Health, the MCH, the TB, and the HIV/AIDS. Even the prevention of airborne infection is being addressed by the Government of India under the revised National Tuberculosis Control Program. We also have the National Blood Safety Policy and other blood safety initiatives which exist under our National AIDS Control Program. Auto-disabled syringes are also being used under the Universal Immunization Program of the Ministry of Health and Family Welfare, Government of India, and there is a system for reporting adverse events following immunization. There's also a national pharmacovigilance program to monitor the adverse effects due to drugs. The SOPs on hand hygiene are also prescribed, in particular in safe delivery, and biomedical waste management rules are now being implemented. So several efforts are being taken, but they're all fragmented, and we are trying to put them all together. So one of the major developments that has taken place is the constitution of an expert group in my own ministry, the Ministry of Health and Family Welfare, Government of India, which has developed the patient safety implementation framework in 2016-17, which has been put in the public domain, inviting suggestions and recommendations from the experts. And now it is, the document is almost on the verge of being finalized. However, we still have many challenges before us. And one such challenge, needless to say, is that we have a plethora of healthcare providers in our country, including the government hospitals, the non-government hospitals, the small clinics, and the big corporate hospitals, and making them all adopt the standardized norms and reporting systems is really not an easy thing to achieve in a huge country with a huge population like India. In addition, the Government of India also came up with the Clinical Establishment Act in the year 2010, which prescribes the minimum standards of facilities and services, but with great amount of effort by By now, it's only 16 out of the total states and UTs of India which have adopted this act, and the implementation, I would say, is still far from optimal. So we still face a great amount of resistance when it comes to the adoption of the Clinical Establishments Act. Moreover, there is absence of standardized definitions for hospital-associated harms or the adverse events, and the lack of organized database to capture and monitor trends of adverse events following healthcare exposure. What we need to do now is to take the patient safety implementation framework further into a country-wide patient safety program with specific goals, which could be the strengthening of the health force, both in number as well as in capacity, the adoption of hand hygiene practices by promoting the usage of alcohol-based hand rub close to the point of care, the standardized surveillance system span country capturing information on the HAI and the other indicators on associated harm during healthcare. Also, the accreditation program for healthcare facility for attaining and sustaining the standards of care, an antibiotic policy, and a rational use of medicine to avoid emergence of resistance. And lastly, but not the least, improving the biomedical waste management for waste segregation, storage, transportation, and disposal. So to sum up, I can say that the daunting challenge that presents itself needs more than the government policies and actions. It needs the collective will of the hospitals, the doctors, researchers, healthcare professionals, and also our own citizens. And we have to make collective effort to create an enabling environment of patient safety. Another aspect of the conference today is, of course, the revolutionizing the healthcare with information technology, and I would say that one of the best approaches that has been adopted by the National Health Policy to fulfill its vision is the adoption of the digital tools and technology to a great extent in the Indian healthcare system. Another aspect of patient safety, of course, is also interestingly the part of this conference, which is the technology, which will be the force multiplier for access, equity, and patient safety for our health system. And both the amalgamation of technology into clinical practice and for patient safety is the need of the hour. But technology cannot mean only cutting-edge medical equipments and machines. The characterization of health technology needs to expand onto the ushering technologies which improve care, which improve access, and also make healthcare at the same time affordable for a common man and woman. The lingua franca between doctors and hospitals and even technologists needs a radical redefinition. And the technology will not and should not replace doctors, but equally so, doctors and health workers cannot remain immune to imbibing technology into the clinical practice and patient's care. These walls must come down, and must come down soon rather than later. India has been uniquely blessed with having a rich history of medical care over millennia, and the old treatises on surgery, treatments, and interventions have been the basis of modern healthcare. Similarly, our country has been at the forefront of the information technology revolution over the past 2 decades, and therefore the confluence of the two is not only natural, but is also a national imperative. Great strides have been made in the field of mobile health, wherein we have launched several mobile initiatives like, for example, M-cessation, e-health, e-ICUs, big data analytics, and artificial intelligence. These solutions and technologies must make their way from the side stream into the mainstream of patient care. And we firmly believe that technology will make health delivery safer and more accessible. Our commitment is to make the electronic medical health records for all citizens a reality, is well underway through the standards for EMRs issued by the government in the year 2014, and our plans to set up the National Digital Health Authority too, which is very much in the pipeline. I would strongly urge all the stakeholders here to adopt EMRs as a way forward to help improve access and continuity of safe and quality care. Ladies and gentlemen, as India is in the dual group of the communicable, the infectious, as well as the non-communicable diseases, we've taken several initiatives, and one such initiative related to information technology is the expansion of the telemedicine network. We are supporting our respective state governments financially and technically under the National Health Mission program, and making set up their own state telemedicine networks so that the PHCs, the primary health centers, and the CHCs, the community health centers within the different districts of the states, they could be connected and linked well with a super specialty hospital or a medical college or a tertiary healthcare institution within the state, so that the consultations and follow-up could be received by patients who cannot travel to far-off distances. And in this respect, I also want to congratulate Dr. Reddy for taking a good initiative when it comes to telemedicine. They've done a wonderful job, and I want to congratulate them from this forum today. Ladies and gentlemen, to this forum, I would like to reiterate our government's firm commitment to make healthcare accessible, equitable, and affordable, and we shall further meet the challenges that I make mention of in a spirit of collaboration and partnerships, and I assure you that in this government, you will have a partner who will be ready to work to make the dream of a healthy India a reality. So I once again thank the Apollo Hospitals Group and the organizers for inviting me here today to the plenary sessions and giving me an opportunity to meet all of you. I wish the deliberations for during this two-day conference a fruitful outcome for the entire health sector, and I would also urge the organizers to make these suggestions and outcomes widely available for future deliberations. Thank you very much.